I want to know the couple things that you see mostly, maybe especially with women in the dental field as business owners, as associates. What do you most commonly see?
Well, there has been a shift. I mean, in the last two generations, where in many schools, the majority of dental students are females.
Mm-hmm.
And I'm not sure why that is, other than the fact that females are very, very good at academics and they look great on paper, and they make incredible clinicians. They have a gentle touch um, and are very artful, where males sometimes aren't, and a little bit more kind of brute force and less finesse. So I think they make great clinicians. So they're suited for dentistry, I think, in a lot of different ways. Uh, as far as leadership in general, I think leadership is something that is really important, something to develop that people don't recognize that it's important to develop. It's one of those kind of right brain skill sets that are in large part kind of neglected and not taken seriously by a lot of pragmatic left brain alpha types. But I think the ability to be a strong leader and build a good culture and communicate well, all right brain kind of soft skills, are what separate exceptional business owners, dental practice owners, from the average or the struggling. And I think that people make leadership and culture and communication harder and more complicated than it needs to be for men and for women. But I think that it's really important to understand the importance of that and cultivate and work on that skill set, just like any other skill set.
I agree. I love that you believe like it can really help progress somebody in their career. So I see like a lot of women struggle in the workplace because even though there are more dental students that are women, right? Mm-hmm. When they come out of dentistry, it still feels like a very male dominant career. Mm-hmm. And I just see it even in my own practice, where if you have a male doctor there and he asks for something or wants something done a certain way, it's like immediately it all kind of happens, right? They ask once, it kind of happens. And then when the woman asks, it's like because most of the team members are generally women also in the office, they feel like that female doctor is kind of one of them, right? It's like more of a friendly vibe, right? And so then what ends up happening is like that person isn't taken seriously. And then when they do make themselves more, try to be more serious and try to have that distance, then they're called all these like terrible things.
Yeah.
Right?
Yeah.
So give these women some advice of like, that dynamic and how to manage that, if you don't mind.
Yeah, I think it is difficult, and I see it happen a lot. I mean, I would say probably 90+% of the people that I ever employed were female, right? So there's the dynamic that you're dealing with a lot. There's power struggles and there's drama, and there are lots of different nuances that you have to be aware of when you're dealing with a predominantly female workforce. One of the things that I do see often is when somebody gets promoted within an organization and they're great friends and peers with people, and then they get elevated to a higher position, and then in a higher position, it's very difficult sometimes for them to manage these people who once were their peers and now they become the boss of their best friend. Right. So this is something that happens every single day, and it leads to drama within, an organization, leads to turnover and lots of difficulty. I think that one of the ways that you can avoid such things is to set really clear boundaries and expectations and separate yourself as a person from the expectations, right? So if you now are a new manager, or you're a new associate dentist, or the new owner of a dental practice, and you have a predominantly female workforce, and they see you as a buddy, and you go out to happy hour together, and you have cocktails together, and you speak on the phone together, there still can be a very definitive line that says, okay, this is my work hat, and this is my social hat, and we're going to draw a line right here. Here are the expectations in the office in a work setting, and here's exactly what that looks like. They're black and white. There's no gray area. We're going to hold you to the same standard that everybody else is held to, whether or not you're my best friend, or you're a male, or we used to hang out, or we went to happy hour last week. Here are the expectations of the organization. This has nothing to do with me. However, here are the consequences if you don't, live up to the performance expectations that we have set. I think that if you set those expectations and friendships happen to fall apart, or there's drama, there may just be kind of a period of time when those expectations have to be set, and you have to be inflexible in certain times of practice growth and evolution.